we are with Lyn Delmastro Thomson. She's the author of You Are Not Your Diagnosis. I'm so excited to share Lyn with you and all the knowledge that she has that really speaks to people who suffer from pain, right, Lyn?
And chronic health issues in general.
Right, and chronic health issues. So if you have been dealing with pain, you have tried different methodologies and it hasn't been working for you, Lyn is someone who knows very well about this subject. And I'm glad she's here sharing with us what she learned on her journey, what inspired her to open a business, and what inspired her to help other people suffering from the same, from chronic pain and illnesses that she went through. And she has some tips to share with us. So I'm so excited. Take over, Lyn. Please let everybody know who you are. Why should people hear from you and learn from you and pay attention to what you have to say?
Well, first of all, thank you for having me here. And just kind of a little bit about me. My health journey really started when I was 25, so pretty young age to have a wake-up call. And I was kind of cruising along in my life, thought I knew what I wanted to do, and I was pursuing a PhD in history, thought I wanted to be a professor, but I had been miserable for about 3 years. And so the summer, I think after the third year of my graduate program, I was supposed to have elective surgery scheduled. And when they did the pre-op blood work, I thought I was a healthy person, and the blood work came back and the doctor said, everything looks very strange. And I felt like I kind of fell down a rabbit hole of what's going on, because I didn't feel like initially anything was wrong. It was just the labs looked kind of funny. And after probably several weeks worth of medical testing in different hospitals and 2 different cities, they came up with the diagnosis of leukemia, which actually I found out 3 years later was not what I had. And I had been treated for that for 3 years. So I'm very passionate about helping people to become advocates for their own health, and also to explore other options than Western medicine, because while Western medicine is great for saving our lives and things like a heart attack and all sorts of situations like that, I think there's a lot of areas where it doesn't have a lot to offer people.
Wow. At the age of 25, diagnosis with leukemia, and being treated for that for 3 years.
Yes.
And not feeling any better. Not even knowing that you had something going on. Wow. How did that impact your life?
It totally transformed my life. I think in the first year or two after this happened, it was more just bringing me to kind of the negative place of dealing with a lot of anxiety, depression, just not feeling well, healthy, energetic. But as I kind of started to come out of that and bring in some alternative healing modalities that I was exploring, and then as I pushed and pushed and pushed to get a different doctor who would look at me more thoroughly and determine, was this really the correct diagnosis? That was really kind of the catalyst for me to start my business. And as I healed, it was like I got really inspired to help other people with what I was learning.
Phenomenal. And besides your own personal experience, I know that you also went after professional experience to deal with your own symptoms. So tell us a little bit about your professional experience.
Sure. So after leaving my history program, I decided that I was going to be working with people, and a background in history didn't really suit to have that kind of foundation to work with people one-on-one. So I went back and I got a master's degree in something called somatic psychology, which is a very different approach than most psychology programs. It blends in the body as well as the mind. And then I started training in a bunch of different kind of specialty modalities. So first I studied biofeedback, and I studied therapeutic yoga. Then I started getting really curious about energy work. So I started to use Reiki, and then became Reiki trained. And then about 5 years ago, I discovered something called BodyTalk, which now is kind of my biggest thing that I do with people. It's a specific healing modality that I find is just tremendous for helping with all sorts of health issues.
Phenomenal. So your own journey inspired you to open your business?
Very much so.
Yeah. So today you work with people who are suffering from chronic pain and chronic illnesses. And share with us a little bit, how long have you been doing this? How long have you been working with people like that?
So my business is about 8 years old. And in the beginning, I was doing the biofeedback and the yoga primarily with clients. And then for about the past probably 4.5 years now, I've been primarily doing BodyTalk, because once I trained in that, it was like I let the other things go because I could get results so much faster.
Phenomenal. So your business evolved
Yes.
throughout the
It
years.
feels like it always sort of does, it kind of
Right.
has its own energy and its own kind
Right.
of way of wanting to be. So you have to kind of allow your business to shift and grow.
Right. And where are you in your health and well-being today?
Much different than when I was 25. So that was 14 years ago that I had that diagnosis.
Mm-hmm.
And then 3 years later, got the correct diagnosis, started being treated differently, but also at that time really became more of an advocate for myself and realized that just taking a pill wasn't going to get me to where I wanted to go. So even though what I have is, at least by Western medicine standards, something that has a genetic component, so it's very hard to completely get rid of, I definitely have a different quality of life than I did 14 years ago.
Phenomenal. And what was your experience as you're going through the whole misdiagnosis? Did you do research about what they diagnosed you with? Did you talk to other people? What would you recommend people who are going through this today? Maybe one or two tips on how to talk to doctors, for instances. Do they listen to you? Did you feel heard? Did you feel that you were part of what was going on, or was just they were just sharing information with you? How was your experience, and what would you recommend for someone who is going through the same thing today?
So my initial experience was horrible. I did not feel like the doctor who was basically in charge of my care listened to me, heard me. He was a hematologist, and he would spend 2 minutes in the exam room with me, basically 2 to 3 minutes, which you think you're caring for somebody with something pretty significant like what was labeled as leukemia.
Right.
And he would ask me, how are you feeling? And I would say, I feel horrible. And he would dismiss everything I would say. He would just say, well, you look really great and your labs look great, so I'll see you in a month. And now I realize, like, at that point, I didn't really know how to advocate for myself in those first couple of years.
Mm-hmm.
And now I'm just such a fierce advocate for myself, and also for like my husband when he has to deal with things. It's like, if a doctor will not listen to you, find a different doctor. If you are the one that lives in your body 24/7, and what you have to say is also important. Yes, they are the one with all the medical experience, but you are the one who knows what it feels like in your body. And if that is not being heard, then I would do my very best to find yourself somebody who will listen to you.
Right. Right. And I know when I was 19, I was diagnosed with PCOS, polycystic ovarian syndrome, and I was told I needed to go through fertility treatment one day if I wanted to become pregnant. And I don't do well making appointments, sitting in doctor's offices, and waiting for, and going here and there. I don't do well with that. So I decided it was not going to be my choice. And if it had to happen naturally, fine. If not, I would just, I would be happy and honored to adopt a child.
Mm-hmm.
And I do believe that we live in our bodies and we know our bodies best than
Yes.
anyone else. So it's important to be your own advocate and be strong and be prepared and be informed, so that when you go, the doctors know that they're talking with someone who they can exchange good information. Because I know there's some people who just wanted to talk to the doctor and waste time, and
Right.
so go prepared with your questions, and
Right. Read up as best you can, be prepared, have your questions listed out so that you know what you want to ask and what are the most important things that you need to share about, how you're feeling, how you're responding to different symptoms. It's so important, because usually you have so few minutes to talk to them that if you're not prepared, you can forget very easily what's important to you, and you're the one who's receiving the care, so you should have some say in what's happening in that room.
Right. Yeah, I find we need to be empowered when it comes to our health and well-being. That's an area of my life I take full responsibility. I learned early on to do that, because I don't do well when I feel disempowered. I don't do well. I start panicking and obsessing about things. So, and the same thing happened once I had my child. I'm thinking, well, I'm with her all day long. I know her.
Right.
Um, I was able to establish good boundaries with my healthcare providers, and feel heard and feel respected, and feel really confident when it comes to health and well-being. And so can you share with us a little bit how you have helped clients who are coming to you because they're in chronic pain, chronic illnesses? Can you share 2 or 3 cases of where you're able to help with your BodyTalk methodology? And
Sure. So one of my clients, I've actually been working with her for a number of years, and she's someone who's has multiple diagnoses, so several autoimmune conditions, fibromyalgia, so kind of, a complex medical history. And just in working with her, she's been able to reduce 2 pain medications by half. For a period of time, she was able to actually go off another medication. And she says that she has more energy than she has in like 20 years, because she's had these diagnoses for a very long time. And she used to feel exhausted just going to the grocery store and, shopping groceries. And now she can come home and not take a nap after doing that, which is huge. We don't think about that if we're not chronically ill, but when we are, it's such a huge thing to not just have one thing exhaust you and to be able to have a more normal life.
It takes a lot of energy not feeling well.
Yes, it does. And everything that you have to do really takes a tremendous amount of energy.
Right. So she had fibromyalgia. Any other clients who have gone through the BodyTalk work?
Well, I had another client who was a young woman, and she had some sort of, I don't know whether it was adrenal fatigue or something like that. I don't think she ever told me what she was diagnosed with, but she would take a medication to have enough energy to get through her day, because that was kind of what the medical system thought, well, she can barely function, let's give her this medication. And through working together, I think we worked together for about 6 months, she went off of that medication, and she said she felt more energy because it was the energy of her body versus this kind of artificial medication energy.
Right. And do you also work with doctors who are open-minded, and when they go off these medications, they're supervised by the doctor?
I haven't worked directly with doctors, but when somebody's coming off of a medication, it's always really important for them to inform their doctor and, to be monitored and things like that, because, sometimes you need to have those blood tests. With a pain medication, maybe just having support, but certain things, like if you were adjusting a thyroid medication, you're not just going to kind of expect, I can stop taking it.
Right.
You need to get labs done and be checked to make sure that everything is recovering in the way that we would like it to.
Right. So common sense is
Yes.
also important.
Yes. Yes. I would never say just stop taking that pill and don't do anything to monitor yourself.
Right, right. Yeah. Common sense is good everywhere, especially when you're making your
Yes.
health decisions. Um,
Yes.
so share with me a little bit about, so you've been in practice for 8 years,
Mm-hmm.
and share with me a little bit about, because some of the people who will be listening to this, to our interview, they are also practitioners.
Mm-hmm.
And some of them are just starting out. Some of them have been in practice for a little while, and some are seasoned. But I have found, I found out that throughout all different levels, challenges doesn't magically disappear. So, and also another thing I have found out is that if one person has a problem, it's likely that other practitioners are also going to have the same problem. So my intention to ask you this is to give people, so they receive value and walk away with value of. So you use your own journey as an inspiration to open your business. You went and you got trainings. You've been in business. You wrote a book. And I am looking at your Facebook page right now, and I see someone who posted I'm loving your book, Lyn. It came in today, So I see people raving about your work. Share with us a little bit, one challenge, let's say, that came up for you when you first started your business.
I think the biggest challenge is always for a lot of practitioners how to market yourself, how to run a business. Like you're trained in whatever you learn how to do, whether that be, being a therapist or a massage therapist or whatever you do, but nobody teaches you, how do you get clients and what do you do to grow a business? So it's like this whole other world that you have to try and figure out for yourself.
Mm-hmm. So that was your first one of your, and how did you overcome that?
I found that it was really important to get a lot of different support. So over the years, I've hired different coaches, I've enrolled in different programs and like really figured out where my weaknesses are. It's like, I know I'm really good working with clients, but where do I need some support in order to reach the people that need the work that I do?
Right. And that is, how long did it take you to realize that? I'm asking.
Probably the first year, it was like, I didn't really quite realize it. And then like after that, it was like, oh, there are these people that are actually business coaches and they can help you.
Right, right. I don't know about you, but when I first got my health and wellness, holistic health counseling certification, I thought everybody was just going to knock on the door and say, hey, Simone, I want to work with you. Yep. But I got a lot of clients and I didn't realize I was already using it in a strategy. So how did you get your first couple of clients?
I think my first couple of clients were referrals. Like I was beginning just naturally to network. Right when I started my business, I had actually been in a fairly significant car accident. And so I was seeing a chiropractor and, she was, of course, just curious about, who are you? What do you do? And I said, well, I'm new here. I'm starting this business. And she actually started sending me a few people that could use the yoga work that I was doing at the time.
Right. So that was an accidental strategic alliance.
Exactly. Like I didn't really know at the time what I was doing, but just that's talking to her and that's happened over time. Sometimes people just say, oh, what do you do? And then there's the curiosity of, oh, that sounds really interesting.
Right, right. When I first started out, I sent out a special announcement to the holistic moms group I was part of. Mm-hmm. And I got clients initially through that group.
Awesome.
They were just, oh, you're doing health and wellness. You need practice clients in the beginning.
Right.
Already, many of them raised their hands, and that's how I got started. Mm-hmm. So it's important to and for me, I realized right off the bat, I started looking like, wait a minute. Okay, I have the certification now. Let's focus on what really matters. And my realization, I don't know if you can relate to this, but my realization was, well, I am a health and wellness coach or counselor. No, I am a business owner and a marketer who does health and wellness coaching.
Yeah. I think that's an important mindset piece to really understand that without that other piece, you can't do the work that you do. You can't do your.
And tell me a little bit, what is your opinion when it comes to marketing? Because I know a lot of people have, oh, marketing, that is so exhausting. And I don't like it. I'm supposed to be seeing patients or clients. I'm not supposed to be marketing.
I think for me, it had to be a mindset shift. I mean, in the beginning, I felt that way, that felt very natural to kind of be like, oh, it's this other thing that I hate. And, oh, I have to go to these networking events. And as an introvert, that wasn't my favorite thing to do. And now it's like, I've just focused on, it's about building relationships with people. And that, and sharing. Yeah. So it's like, give value, I mean, a lot of the things that I do online, it's just sharing information. It's not intended for everything to be like, pay me for every little piece of knowledge I share with you. But the people who resonate, they go and buy the book, or they reach out to me and they say, I think I need your help.
Right.
And it's so much more natural.
Absolutely. So you're practicing like a pull marketing instead of pushing. And also share a little bit with us, what is, after your 8 years in business and you shifted your mindset about marketing, and you, like I said, you're an author and you share and you network, what are some of your challenges right now, or one specific challenge for someone who have been in business for 8 years, let's say?
I think for me, it's like reaching, new levels. It's like reaching even bigger audiences. That's part of what the book is. That's part of what doing more speaking is not just, I can work with people anywhere. They don't have to be in my local area. And so I want to allow that kind of expansion of the business, and it's figuring out, it's a different way of marketing, of course, when you're kind of more of an online business versus people who are just trying to get clients in their own city.
Right. So initially we go for starting out, then you're building, and then you leverage.
Right.
It's about leveraging your business. And what do you find is is a challenge with that for you?
For me, like, I'm stepping more into the public speaking arena this year, and that's a new area for me. It's something that, I guess, growing up, I always believed I wasn't a public speaker. I saw myself in a certain way. And so there's been some personal growth that has to happen to be able to step out there and kind of step into the spotlight, so to speak, and say, I have a message to share, and I'm not going to just hide in the background.
Right. And you mentioned you used to be an introvert. Is that still the case?
I am an introvert, but I think I figured out how to leverage it in a different way. Like, I thought it meant one thing in a certain sense, like of, well, you go to these networking events and there's 50 people in the room and that's overwhelming. And now I figured out like how to network more as an introvert and use the strength of the connection that I can create with people one-on-one versus trying to meet 50 people in the room.
Right. I, believe it or not, I used to be, or I am somewhat an introvert. I have kind of the two energies. I'm not so much an either or, but I'm both and. Like, very outgoing, but then I need my time, my space to calm and rest and relax. But in the beginning, it was very, very difficult. I remember going to networking groups or meetings, and she must, an interior decorator, part of the group, she must have seen on my face, I was terrified. Oh, like, Simone, just sit over here right next to me.
Right.
And I had a cup of coffee. I was shaking so much. I really thought everything was going to spill all over the place.
Right.
And plus, I'm the kind of the shy person who, when I say something, I turn all red. I didn't like a lot of attention on myself.
Right.
And I would turn red. My ears were like, red. And I'm like, I just wanted to hide under the table.
Yep.
Yes. But one thing that really got me through was making sure that my business I took a stand for something.
Mm.
And back then, when I was working health and wellness, I asked myself this very, profound question. Yes, I have a business. Yes, it needs to be profitable. Otherwise, I can't carry on this business. But what am I standing for? What am I passionate about? And what makes my heart sing when I see that happen?
Mhm.
And back then was health and wellness. So I'm like, okay, I'm taking a stand for people having a healthier and happier life. And that really got me going. And there was nobody who was going to stop me from doing that. And I wouldn't shut up after.
Right.
Right. And I was able to make a lot of connections. And people say, wow, when you really take a stand for something, your eyes light up. You
Mhm.
smile with your eyes. People really get interested in what you have to offer versus walking in a room not feeling really confident. So bottom line, what we do, I don't know if you agree with me, but what I learned is that it's not about us.
Mhm.
Can't be about ourselves. It has to be something beyond us.
Right.
Like you taking a stand for people who are in chronic pain, who are being misdiagnosed, and who don't have a good quality of life because of that.
Mhm.
And waking up every day, doing the things you need to do to share your message and connect with people. So as a result, more and more people can have the quality of life that you have and the clients that you have helped with also have. So I'm very excited for you. And so share a little bit as we come to close in our interview. Share with people who are listening, how can they find you? If they're not feeling so good, if they know a friend or a family member, a colleague, or client, someone that are complaining that they are taking medication, they don't feel well, they have been to different doctors, and they still don't feel well, where can people find you?
So my website is pretty easy to remember. It's bodytalkportland.com.
Okay.
And so there you can find me there. There's all sorts of wonderful free resources there. And if you're curious about the book, You Are Not Your Diagnosis, you can also find that on Amazon. You can just look it up. And it's both digital and a paperback copy, depending on which you'd prefer.
Perfect. And people can work with you in person, I mean, locally,
Mm-hmm.
or virtually.
Right. Yeah. Actually, this week I'm traveling, so my office is this hotel room. This isn't
I was
my
going to ask you, where are you?
I'm in Utah right now. My husband had to have some specialty dental work done. And so I can work from anywhere, and I can work with people all around the globe. So I actually now have some more international clients, which is really fun to connect with people all around the globe. And energy is energy, so I can work with people anywhere.
Anywhere. Perfect. Thank you so much again, Lyn, for sharing your expertise. And if you wanted to find Lyn, you go to bodytalkportland.com,
Mm-hmm.
and you can also find her book on Amazon, You Are Not Your Diagnosis. Thank you so much, Lyn, again. And for all of you who are watching, make sure you reach out to Lyn if you need, and leave your comments down below. Thank you so much for watching us, and until our next time.